Well, hello and welcome to all of our gold delegates from around the world. I'm Fiona Langsharp, IBCLC Director of Communications and MC here at Gold Learning. Today, we are talking about our upcoming Gold event, our Gold Neonatal Online Conference 2021. Well, today I have Jennifer Barnes is here with us. She is going to be presenting live at our Gold Neonatal Conference. All the details, of course, are on the website right now at goldneonatal.com. You can catch up with when our schedules are, and of course, read up on all the details of the events and our add-on packages here as well. Welcome to you, Jennifer. It's good to have you here today.
Oh, thank you so much for having me. I'm really excited for doing this presentation next month.
Yeah, absolutely. So, Jennifer, could you please tell folks a little bit, since we have an international audience, share a little bit where you are in the world and tell them, what it's like there and where you're currently working.
Yeah, so I work at Levine Children's Hospital. I am their clinical neonatology clinical pharmacist specialist. So that covers anywhere between OB questions about lactation and medication use to primarily where I'm at, which is the NICU, the level 4 ICU,
Hmm.
as well as our step down unit as well. So that is in Charlotte, North Carolina, which is kind of the middle of the East Coast. So I've been in this position for about 4 years now, and so I really enjoy working at Living Children's with all our fantastic providers.
Oh, that sounds wonderful. So, Jennifer, tell me, how did you end up in this position in your world and in your life? Was this something that you had aspired to do, or is something that you diverted to do when you were training? Tell me a little bit about it.
Yeah, so I think probably no, not every NICU has a clinical specialist for their farm. They might have, they think of a pharmacist maybe as what they see, on the corner, their corner drugstore.
Sure.
I think there's a whole world within that as far as clinical pharmacy. And so I originally actually went into pharmacy school thinking I wanted to do geriatrics, right? I couldn't have
Okay.
gotten further from
Right.
that pathway. But really, I just didn't even know about pediatrics being a potential specialty within
Ah.
pharmacy.
Mhm.
And I had my pediatrics rotation during school, and I was like, "This is fantastic. I would love to learn more about that because I feel like we talk so much about adults that we really don't really think about how medications affect our youngest uh, people." So
Right.
yeah, I got excited about it, did residency, and so ever since then have been doing pediatrics, and then did a more general pediatric specialty, and then really just loved the NICU. I loved the fact that you can, as far as you can see how medications change even in
Mm.
the same baby in their first month of life, and that is just
Wow.
so incredibly interesting. That yeah, the neonatal population is just so dynamic,
Yeah.
and so I really have felt that there could be, more interest in that. There really is a need for a focus on how those medications interact in those babies. So,
Yeah, absolutely. And I think, yeah, I mean, I also find this topic very, very interesting, only from the point of view that, there's a lot of research in adults when it comes to medications,
mhm,
and very little in pediatrics. And of course, we're giving adult medications to these little tiny neonates. Like there's really a lot to work through, and things have changed over the years, and so we've got a lot more under our belts, but for so long it was just a lot of guesswork.
mhm.
So what are we doing today, Jennifer? Like how much are we experimenting? Because sometimes we have a situation that could mean life and death for this little neonate, and that can be pretty intense at times. Are you still faced with some of those things, Jennifer?
Oh yes, I think there's never a dull day, right?
Mm-hmm.
And I will say that there's probably more emphasis than ever on national and international level about getting some of these clinical trials when a new drug comes out, about
Mm-hmm.
having pediatric and even neonatal studies. I mean, I think if you look at the top 20 drugs of that are used in the NICU population, I think only like 8 of them in general are actually have FDA approval.
Right.
So it's always that part is interesting. But I think really that emphasis that doing some of those even at your own institutions, like are you doing some observational trials and whatnot, and seeing how those effects can be. So I think from an international standpoint, and national, we're getting better about our manufacturers doing
Mhm.
those studies, but then also I think within institutions we're yeah doing more research than ever.
Right. Yeah. Yeah. And then sharing that amongst your,
Hmm.
cohort, other neonatals around the world. I want to talk a little bit
And the
about
beauty
your,
is caffeine is one of the few
oh,
that actually is really just studied in neonates.
ah,
So
there you go.
that's the beauty, is that this one's all about us.
Ah, that's really good. Yeah. And speaking of course, that's the topic that you've actually brought to Gold Neonatal this year. So you're going to be, I'm going to read the title because you're going to get a kick out of this. So, Starbucks for Babies, Caffeine Use in Neonates is what your title of your presentation is. But why don't you share a couple of things since you tipped us there that you were going to be sharing on it? Let us know a little bit or a couple of things that we're going to be learning in your presentation.
Yes, I think caffeine is arguably the most commonly used medication in the NICU population.
Hmm.
And so I think, and we've been using it for decades now. And so I think many places we were like, oh, yes, we know about caffeine, but I think so much information has come out. And while, almost every NICU in the across the world uses caffeine, there's so many nuances about it that we really have
Right.
not come up with a consensus. So I think the focus of this study is really just to talk about some of the expansion of caffeine is good for so many things other than what we
Right.
traditionally, had studied it for, and looking at, okay, so that's the what are we using it for, but the
Hmm.
how much, the dosing has changed very dynamically, when to give it. At that time frame, for how long, when do you continue caffeine until, I think there's so many controversies of that. And so really we're going to focus on kind of the nitty gritty of not just who's caffeine for, but what are some of the nuances of it. And then as far as like what monitoring and what side effects to look for, every medication
Mm.
has side effects, and while caffeine is generally very safe, there are certain things that our healthcare providers can be looking for to make sure that we're giving the safest dosing possible.
Ooh, so many things to think about. So yeah, so if you are working in a NICU right now, you're probably familiar with using caffeine, but do come to this presentation to learn even more from Jennifer. She's going to be showing us all those different details and how we can use it appropriately and how it can improve outcomes. This is just so interesting, I have to say, Jennifer. Yeah, this topic, even having a little bit of a sneak peek at your presentation today, and learning a little bit more about how it's utilized and what we've done in the past is just it reminds me of how we have progressed and made advancements in the neonatal units around the world. I was going to ask you, you alluded to or talked a little bit about sharing internationally with some other hospitals or associations. How much opportunity do you get yourself as a pharmacy specialist? Because I feel like this is a little bit more of a niche area in clinical practice. Do you get to share with other people around the world or nationally? Like how much reach do you have right now?
Yeah, so I think all depends. I'm very active in a US based
Sure.
organization. It's called the Pediatric Pharmacy Association. And so I think
Hmm.
within that, for example, I chair the neonatology specialty group, and we have while like I said, it is mostly a American based organization. We have a
Right.
ton of dialogue, just on even a daily basis. There's
Oh,
different,
wow.
the email lists are going out with different questions that come out, and so I think with that, I'm very fortunate that there's so much sharing
Yeah.
amongst the different groups and just asking questions, and we have a very candid dialogue amongst the different groups of pharmacy specialists that work
Hmm.
in neonatology. So always looking to see what we do, because we definitely never want to get tunnel focused, that just open for
Hmm.
constantly learning and sharing information.
Yeah.
amongst
Wow, that's
everyone.
fantastic. Well, and that just makes for better care for
Mhm.
our infants, and our families. So improving outcomes all the time and sharing what we're doing is going to be so important. Well, thank you so much, Jennifer. This is just great news, I think, for so many people just to be alerted to that. Again, with your profession being a clinical pharmacy specialist in the NICU, it sounds like you found this great path on your journey coming from perhaps geriatrics right the way through to pediatrics is just amazing. So thank you so much for sharing today. It's been great getting to know you.
Oh, thank you so much. I'm really excited to talk about it. And so just really share that everybody loves caffeine, myself included. So
That's right. That's right. Well, thank you so much to Jennifer Barnes for being here today. Don't forget to check out all of the information that we have on our website. You can go to goldneonatal.com right now. Registration is open for this entire event. We've also got some very special add on packages for you. Dates and times are on the website. Jennifer's going to be here live. So you'll be able to come and enjoy the opportunity of working with her, collaborating, asking questions with other colleagues from around the world as well. And if you can't make it on the live date, don't forget all of our sessions will be recorded for your convenience. Thank you so much to Dr. Jennifer Barnes for being with us here today. And of course, to all of you, our gold listeners. Thank you. Goodbye for now, everyone.